With the arrival of value-based care, the patient experience and patient satisfaction are fundamental to any medical practice or health organization looking to maintain their financial security. One short and simple path to achieving that goal is streamlining and optimizing patient flow.
I mean, we've all done it. We've all gone and sat for an hour, 2 hours in a waiting room or in an exam room waiting on a physician, and nobody has time for that.
This is former nurse Jennifer Durbin. She knows the struggle of doctors' offices all too well, now as a lean clinical consultant.
So Kathy, this is the last month's data for all of the suites for Newburgh.
She helps medical institutions like Crystal Run Healthcare in Newburgh, New York, become more efficient and productive with the Expeditor Lean Patient Flow system.
It helps improve the efficiency of the clinic.
Expeditor believes patients should have a voice, and now more than ever, patient feedback matters. In fact, many patients often complain that the biggest waste of time at doctors' offices is the wait in both the waiting and exam rooms. Expeditor believes that understanding the patient's feedback on patient flow is important to improving satisfaction and experience in a clinic, and they do that by working closely with the client.
The goal is to sit down with our clients, collect the data first of all, capture the data from the light system, sit down with the clients, analyze the data, and try to find ways to remove the patient flow bottlenecks.
There are 3 key elements to Expeditor's success.
It's just our lighting system.
Expeditor starts with a customizable light signaling system throughout the clinic. How does this system work?
Okay, so when the nurses go in the room, we push the light twice. So that way everyone in the suite knows that we're in. So then once we're finished, we come out the room, we turn our light off, and we turn the doctor's light on.
This system is so great in the fact that the providers know where to go. They follow their lights, and it saves that time in between patients.
Injection is the doctor's light and the nurse's light.
They can actually look down the hall and see what's going on based upon the light signaling system.
As the lights are pressed, you're going to see the timers start.
The data generated from the light system is displayed on a large real-time monitor, so providers and staff can easily see the status of rooms and monitor the flow of patients. This allows for immediate and actionable changes to be made.
They're waiting on that direction, and this system allows for that direction, for that visual management, for them to know which room to go into next.
The patient flow data is fed to the Expeditor team, where it is carefully analyzed according to the client's needs.
So as we go in, we're able to see each of the providers.
Typically, the analysts schedule a monthly web share with each client to review the previous month's performance. This provides the client with a unique view of the patient flow within the clinic.
The compliance is 85% on the right-hand side, which is fantastic. We want that compliance to be 70% and above.
This Expeditor door-to-door patient flow system was fully customized with Crystal Run's needs in mind. It helps both patient experience and satisfaction, as well as increases their bottom line through gained efficiency.
One of the things that's really important to us here is managing and reducing wait time for our patients, whether it be in our pause areas. Notice I didn't say waiting rooms because of our lean efficiencies. They are called pause areas, and also in the exam room.
Crystal Run's Newburgh location boasts over 66,000 square feet of usable space, with 40 different medical and surgical specialties all under one roof. In facilities of this size, bottlenecks and inefficiencies are common, but they don't have to be, thanks to the Expeditor Light system.
I think the staff just saw the value in utilizing the Expeditor light systems and seeing how it really helped the patient workflow and efficiency, and then they really embraced it as a culture here.
We've improved that room to door time. Look, we've gone from 41 minutes to 34.
That's great.
Which is impressive.
Providers who use the Expeditor Lean Patient Flow solution can frequently recover up to 60 minutes of time that would have otherwise been wasted trying to navigate their patient flow. Saving that amount of time allows the facility to see 2 to 3 additional patients per day and gives the provider nearly 12% more time with each patient.
I'm just really impressed by how the staff really use it, see the value in it.
Why is there a growing need for continuous improvement in today's healthcare system?
Continuous improvement is about continually looking at the data month to month and making sure that we're not falling off of our goals.
The minute you let go of not looking at that data month in and month out, things start to slide. So it's necessary to make continuous improvements.
Applying lean continuous improvement management principles streamlines communication and increases patient flow, making both those in charge as well as those in need satisfied.
That's why this building and the lean buildings were built, so that the patient experience would be the best it can be. And also giving the employees and the staff the tools to do the best they can be for the patient.
Practices like Crystal Run can see a return on their investment within 3 months. That translates to seeing up to 3 more patients per day per provider while delivering great quality care and a higher patient satisfaction. In Newburgh, New York, I'm Danielle Elias.